MLA. He joins us and he's most welcome. Speaker Poots has given distinguished and dedicated service since he was first elected to the Northern Ireland Assembly way back in 1998 and is the only one of two remaining members elected on that occasion. Speaker Poots, I very much look forward to working with you as I worked with your predecessors, my good friend Robin Newton and Alex Maskey. And I suppose I can say that in the best traditions of this island, both north and south, the door of this house will always be open to you and the kettle will always be on the boil. Now, can we hear Deputy Mary Lou MacDonald, please?
Good Ceann Corla agus fád Siród Edwin. I'm not used to seeing you in this setting, but you're very, very welcome. I'm sure we all agree on that. Taoiseach, over the last few days, people have listened in horror to the testimony presented at the inquest into the death of 16-year-old Aoife Johnson. Aoife died in University Hospital Limerick on December the 17th, 2022, and the inquest is ongoing and we await its verdict. We have heard that on that fateful night in 2022, when Aoife presented to the emergency department, it was under enormous sustained pressure. The senior house officer on duty that night has said that nursing staff were overwhelmed with patients seeking treatment. She said that staff were left in an impossible situation due to the severity of overcrowding. Staff shortages were a huge issue. And again, the doctor said that the emergency department was not a safe environment for patients. Aoife had presented with suspected sepsis, so time was of the essence. But she was left waiting for 13 hours, lying across two chairs as a makeshift bed, before eventually being seen by a doctor. There wasn't even a trolley available for her. Aoife's heartbroken parents, Carol and James, called out for help as their daughter deteriorated, but have said that there was no help. Carol said, "We watched our daughter die. I wouldn't wish it on anyone." Taoiseach, I raise Aoife's case because it speaks in the most heartbreaking way to the depths of the crisis at University Hospital Limerick. The chaos in the emergency department that Aoife and her family faced that night is what faces patients and staff all the time. The hospital's full overcrowding alert was enacted every other day last year. Just let that sink in for a moment. This is a hospital operating at permanent surge capacity, and the surge is every single day. UHL is in a constant state of emergency because it simply does not have the level of staff or beds it needs to deal with demand. The result is chronic overcrowding, persistently high trolley counts, and people denied healthcare with thousands of appointments cancelled every month. Taoiseach, the hospital is short 200 vital staff. The panels are in place, but staff cannot be recruited because of your embargo. The blocking of recruitment when a hospital is on its knees just beggars belief. To get ahead of this crisis, the hospital also needs 288 additional beds, and it needs them to be delivered rapidly. And while your government has announced some limited measures, they fall far, far short of what's required. And the reality now is that staff, patients and the public in general feel very unsafe. Is mór an colúint I bós Aoife Johnson. Thug sé léargas na fear contourtí a bhaineann le róflódú an ospidéal na Hullscoile Limnach. Tá fear ahrú tastal a winter an van iarthar Madger le Cuaram sláinte. Taoiseach, this cannot go on. The people of Limerick and the Midwest are at the end of their tether with the constant crisis in their hospital. They're screaming out for action and they believe government is not listening. They want government to effectively address the crisis with speed and with purpose. So here's what you must do, Taoiseach. Firstly, end your dangerous recruitment embargo so that University Hospital Limerick has the staff it needs to meet demand. Secondly, Deliver the additional beds the hospital needs with urgency to tackle overcrowding. And thirdly, and importantly, invest ambitiously in local out-of-hours community health services to relieve pressure on the emergency department. These 3 steps would transform the situation. Taoiseach, will you take them?
Taoiseach, please.
Gurmagat, Ceann Corlin, Gurmagat Iachta, and thank you for raising this very important issue. May I join with the Ceann Corlin, Deputy MacDonald, in welcoming Speaker Poots to Dáil Éireann. It's great to have you here, and I know everybody in this House looks forward to working with you and colleagues and counterparts in the Northern Ireland Assembly and the Northern Ireland Executive. I want to thank Deputy MacDonald for raising this extremely important issue. As she alluded to, I'm very conscious that the inquest is going on in relation to the death of Aoife Johnson, and I, like her, don't wish to say anything to cut across that process. I think we'll certainly all have a lot to say when that process concludes. But let me, at the outset, express my deepest sympathies, and I know the sympathies of everyone in this House, to the family of Aoife Johnson. I can't imagine their pain, their grief, their loss, in terms of the loss of a daughter, the loss of a sister, and the pain they're living with every day. As I've said, the inquest is going on, so I will refrain from commenting on that. But as you do know, the HSE Chief Executive, having considered a report that he received into the death of Aoife Johnson, which had very significant findings about the care of Aoife and the operation of the hospital, did appoint former Chief Justice, Mr. Justice Frank Clark, to conduct a formal investigation. The outcome of that investigation, I think, is going to be very important. I'm sure we can all agree on that, in terms of informing any further decisions that need to be made. And in instigating this investigation, the HSE CEO quite rightly apologised unreservedly to Aoife's family and moved to assure them that any issues raised will be investigated thoroughly, fully and without fear or favour. I want to add my voice to those sentiments. I understand the HSE expects that report from Justice Clark by the end of May, but of course it's important that he has sufficient time to fully complete that work and to deliver a good and robust report. Look, I fully accept there's a very serious situation in the University Hospital Limerick. It would be simply not credible to suggest anything to the contrary. But I do need to say that against a backdrop of, I think, legitimate questions that do need to be asked in terms of the level of investment that has been made in that hospital. Because let's look at a number of facts. So staffing at the hospital has grown by over 1,100 since the end of December 2019. So over 2,800 staff to now over 3,900 staff as of the end of February. This is a 42% increase in staffing levels in the hospital. It includes very specifically 161 more doctors, 49 more hospital consultants, 433 more nurses and midwives, and 116 more health and social care professionals. University Hospital Limerick now has more emergency department consultants than any other emergency department in Ireland. And we have seen, and I want to pick up a valid point you've raised, and I've heard you say it a few times, and I've raised it with the HSE as recently as today, because you talk about the safe staffing levels and you talk about the nurse numbers required in the hospital. I've been told very categorically in black and white here that the extension of safe staffing to EDs, to general and to specialised medical and surgical settings is fully funded. So I absolutely expect the delivery of the safe staffing levels to EDs, to general and specialised medical and surgical settings in Limerick and indeed in all hospitals. I'm going to pursue that on the basis of the issue you've raised, and I'll come back to you. I've also seen that the budget for the hospital is now €382 million. It's a 44% increase in 5 years. And actually, there is no other hospital in the country that has seen that level of increase. So the recently published hospital activity report, which gives an overview of the change in expenditure at hospital levels, places UHL at the top, and total expenditure in Limerick has more than doubled. It is the largest increase in expenditure over the period. Now, specifically to the 3 issues that you've raised, all of which are sensible issues. In relation to the embargo, I mean, we do live in a country and within a health budget that does see capacity for 2,200 net additional posts within the health service this year. We can debate around recruitment, but there is funding for 2,200 additional posts. There will be more nurses, more doctors, more therapists, more people working on the front line of health care at the end of this year than the start of this year. And I have been very clear in relation to safe staffing levels and the fact that they are fully funded in the settings that I've outlined. So I'll come back specifically in relation to your view on the impact of recruitment on the staffing levels in that hospital. Secondly, in relation to beds, and you did acknowledge that we have worked to increase bed capacity whilst saying we need to go much faster and much further. We have already had 150 new beds open in the University Limerick Hospital Group since January 2020. 98 of them are at the hospital. Work has commenced on a 96-bed ward block at the hospital in Limerick. And there's been a number of other interim measures, which perhaps I can come back to in a moment, that have been taken in recent weeks.
Thank you. Taoiseach, Deputy MacDonald.
So, Taoiseach, you say you're listening, but clearly you're not. So, if everything were as rosy as you portray, well then how is it that University Hospital Limerick consistently has the highest trolley count? How is it that frontline staff and their unions consistently have said we do not have the staff to deal with the level of demand? This is a hospital that is enduring surge every single day. You're not disputing that fact. So the facts as they present on the ground is that the emergency department is not safe. People do not believe that the hospital is safe, and that is a huge problem. The panels have been established. The additional staff is needed, and so too the hospital beds. But we have to start, Taoiseach, from a position of acceptance, because you can quote whatever figures you wish. We could go into the history of the closure at Nina, the closure at Ennis, how regionally that created a huge pressure point at University Hospital Limerick. That's now in the past. We need to deal with the present. And in present circumstances, the situation is unsafe. So rather than trading numbers with me across the floor of the House, I would like a commitment from you that the recruitment embargo will end, that the additional staff will be recruited, that you will have a far greater ambition in terms of beds, and that you will commit to making this hospital safe again. That is the demand from Limerick and the Midwest.
Thank you.
So look, and I say this respectfully, it's hard for me to answer the question if when I answer the question and use a number or you just say you're not listening or don't quote statistics at me. You quoted statistics at me and I reply. You ask a question, I endeavour to answer the question. I did make the point, and context is important, and it's important for people in Limerick watching in on this discussion today. Sometimes the impression is given that resources aren't going into a hospital. This is a hospital that has more emergency department consultants than any other emergency department in Ireland. And so that has to be acknowledged, but we have to have an honest debate. It's a hospital that has seen a greater increase in staffing levels than many other hospitals. It is a hospital that has seen a massive increase in budget as well. And you've acknowledged we are taking more measures around beds and bed capacity too. There have been a number... Well, hang on a sec. There's many people in that hospital every single day, and many incredible people working in that hospital every day getting very good treatment. And you and I acknowledge that. There have been... I don't know, please. Sorry, I'm trying to be helpful. There have been a number of very difficult issues, one of which is before an inquest, which neither you or I wish to cut across at this point, but we'll both have plenty to say appropriately when that ends. I am telling you this, though. There's a need to do a lot more in Limerick. I accept that. I'm telling you that I'm specifically following up on the safe staffing levels for Limerick, because that is funded. And the Minister for Health very recently did outline a number of additional measures he intends to take in the here and now to increase capacity. It isn't a lack of budget. It isn't a lack of a willingness to do more. But there is also a need to ask about, hang on a second, when you're putting that amount of additional investment into a hospital, why are we not seeing the improvements for patients? And that's what the Minister intends to get under the bonnet on.
Okay, thank you very much. Deputy Holly Cairns is next.
Taoiseach, I've been raising for years now the issue of specialist treatment for eating disorders. The news that no new inpatient beds for adults with eating disorders have opened should be surprising. But given all of the broken promises and missed deadlines over the years, how could anyone be surprised? But we should be, and we should be shocked. Shocked at the lack of urgency, at the level of mismanagement, shocked at the complete lack of help and hope for so many people who are seriously ill. Taoiseach, in 2018, when you were the Minister for Health, the HSE published a new national model of care for eating disorders. Under that plan, 20 new inpatient beds were promised. They were supposed to be delivered by 2023. To date, 0 have been delivered. Not only has there been an abject failure to deliver these beds, there hasn't even been an attempt. The Journal has confirmed today that no new funding was provided at any stage in the past 6 years to open these beds. Taoiseach, as it stands, there are just 3 public beds in the entire country for adults with eating disorders, all of which are located in St Vincent's Hospital. So that means that only people who reside within that catchment area can get treated in those beds. So 3 beds for the entire country, and most of the country can't use them. Taoiseach, I have to say it doesn't seem like the government understands how serious eating disorders are. Over the years, I've spoken to women who've been forced to speak publicly about what they're going through, to set up GoFundMes to get the care that they need. I've spoken to parents at their wits' end, watching their children quite literally waste away in complete disbelief that there's no support for them. I've spoken to people who work over in the NHS who are seeing Irish women coming over at death's door because they can't get the care that they need at home. That reality doesn't seem at all represented in the government's response. 0 funding to provide more beds at any stage in the past 6 years. Taoiseach, anorexia has the highest mortality rate of any mental health condition, and incidences of anorexia are rising. In 2022, admissions were the highest in a decade. And yet when people are at death's door, when early intervention obviously isn't an option, there is nowhere for them to go because the beds don't exist. Sometimes the HSE will pay for private treatment for people, sometimes it won't. There's no clarity, no transparency around how those decisions are made. I want to acknowledge that there has been some progress with regard to care in the community, but we know that many people are far past the point of needing that early intervention. It's not an option for some people. People urgently need inpatient care. So Taoiseach, 20 new inpatient beds for adults with eating disorders was promised in 2018. When will they be delivered?
Deputy Cairns, Taoiseach, please.
Well, I want to thank Deputy Cairns for raising this issue and acknowledge that it's an issue she raises on a regular basis and quite rightly. And I do want to assure you that I wish to show commitment to enhancing specialist services for eating disorders, including improved access and including shorter waiting lists. And I do accept that this is an issue in every community right across Ireland. Historically, I'd also agree that there has been a lack of publicly funded services for people with eating disorders in Ireland. We're coming from a very low place in terms of a record of investment, but I would point to the fact that the new model of care for the National Clinical Programme for Eating Disorders in 2018, as you've referenced, does mark a very significant milestone in terms of having clarity around how we intend to deliver and design our services, and indeed, absolutely, a list for government in terms of initiatives that need to quite rightly be funded. Research does show that the most effective treatment setting for eating disorders is in the community. I'll come back to the point you make about outside the community in a moment, but because it is right to say that a small number of people, mainly with restrictive eating disorders, will require inpatient care for stabilisation and indeed for other reasons. But 90% of eating disorder services are delivered within the community. The HSE does work hard to meet the needs of people with eating disorders in the setting most appropriate to their needs, whether that be the community eating disorder teams, beds in the public system, or indeed, as you've acknowledged, specialist beds from private providers funded by the HSE, or on occasion treatment abroad scheme. But we need to definitely be in a position where we can move away from that. Based on multidisciplinary community teams, the National Clinical Programme for Eating Disorders is now being implemented on a phased basis across the country. There are now 11 teams in place, 6 adult teams and 5 child and adolescent mental health service teams. 6 of these teams only started last year. So I suppose I just would slightly push back in terms of the lack of progress. We did start 6 of these teams in the last year. More than €8 million has been allocated to the National Clinical Programme since its establishment. About 100 posts have been funded through that programme. We now live in a country where there's 80 eating disorder clinicians, a little over 80 in fact, including 10 consultant psychiatrists. Adults who have an eating disorder diagnosis and require inpatient care can be referred to any of the HSE's acute inpatient mental health approved centres around the country. Eating disorders do affect a relatively young section of our population disproportionately, and there are currently 20 dedicated eating disorder beds across the 4 CAMHS inpatient units. As of the 23rd of April, in relation to that list, there was nobody waiting for access in that area as well. Access to services is increasing, twice as many assessments conducted last year as the year before. That's 449 assessments versus 227 as well. As part of additional funding secured under the last budget, a number of new posts will now be available to support youth mental health service provision and development, and this does include new specific posts to support eating disorders. Specifically though, in St Vincent's, for adults requiring inpatient care, CHO6 does have the 3 dedicated beds for eating disorders based in St Vincent's. The need for additional inpatient beds has been identified. The Deputy is entirely correct in the model of care and in other policy documents. A recent HSE mental health bed capacity review did include eating disorder beds, and it is intended that a number of dedicated adult beds will increase in line with the model of care recommendation to get us to 20 adult inpatient beds.
Taoiseach, Deputy Cairns.
Taoiseach, like I said, I do welcome the opening of the 11 treatment hubs. Care in the community and early intervention is obviously hugely important, and I acknowledge that. It's not what I asked you about, but on that, we're missing the target there too. 16 treatment hubs should have been opened by 2023. So treatment does remain a postcode lottery. And it's not just adult services that are at breaking point, it's the adolescent ones too. So in some areas, 45% of beds are actually empty. And according to the Psychiatric Nurses Union, the HSE's own recruitment embargo is the reason for that, because there simply isn't the staff for them. So just on that, I suppose, is the government's plan to lift that embargo to address that issue? But Taoiseach, back to what I actually asked you about, more desperate than that situation is the issue with inpatient beds for adults. You acknowledged that we need them there. There is no funding allocated. So can you tell us when will funding be allocated, and when will we actually see the delivery of those 20 inpatient beds for eating disorders?
So I do fully acknowledge there is a need to get from 3 to 20, and that is a statement of fact. That's government policy. It's in the model of care. It's in other policy documents published by government, and it's been endorsed, if you like, by the HSE mental health bed capacity bed review. What I did outline was this year the area of priority in terms of additional investment going into this area is around some of the youth mental health and the CAMS provision. I can send you a note on what we intend to get done this year. I did think it was interlinked to make the point in relation to at the CAMS level, we do have the 20 beds across the 4 areas, and as a result we had zero, and as a result we had 0 people waiting for a bed yesterday. So I do just need to say that. In relation to the issue of the direct answer to your question is we need to get from 3 to 20, and I do intend to make more progress on that in the budget. In relation to the piece around recruitment, like all of this has to be seen in the context, and sometimes the debate in this House is a little bit skewed. There is not a ban on recruitment in the health service. 2,200 more people net will work in the health service, and probably more, but 2,200 more are funded at the end of this year than last year. That's true. That doesn't include disability services. It goes up to over 3,000 if you include disability services. And of course, within that budget, the HSE does need to make decisions as to where to direct that investment on the front line, and I'll specifically talk to the Minister for Health around the importance of this area.
Thank you very much. Deputy Mick Barry, please.
Taoiseach, access to safe, clean water and sanitation, that's a human right. It's a right that is being compromised for thousands of Cork City households today. For the best part of 2 years now, brown and orange, dirty, discoloured water has poured from those taps. Now, 8 days ago, your Taoiseach asked Uisce Éireann for a clear timeline for solving this problem. The public have heard from Uisce Éireann on a number of occasions in the last week, but still no timeline, I'm afraid. I think it is increasingly clear that the ancient water pipes that lie beneath the ground in Cork City need to be replaced as a matter of some urgency. Uisce Éireann tell us that 54% of the pipes are cast iron and are between 65 and 100 years old. They have quoted a cost of €500 million if those pipes are to be replaced. Taoiseach, will you commit to spending this money if it is the only way to fix the problem? What happens in the meantime? In the meantime, households are spending €15 a week and more on bottled water. That is €750 a year, the price of 2 or 3 water charges. These households should not be forced to pay 1 single cent. I'm asking you now, Taoiseach, to ensure that they do not do so. Will you commit to coming up with a scheme to provide safe, clean water to the people of the affected areas free of charge? That could be organising tankers full of water to tour communities, stopping off at distribution points. It could be providing households with vouchers that can be exchanged in the shops for bottled water. It could be providing households with supplies of filters to be fitted to the taps. But one way or the other, households have to be relieved of this financial burden in a cost of living crisis, and safe, clean water needs to be supplied by this state. Now, last Thursday night, nearly 100 people gathered outside the Church of the Ascension in Granabraher and marched down Cathedral Road in protest. I don't think that will be the last protest of its kind. A campaign is now underway, and I think it can grow. Taoiseach, you need to familiarise yourself with the issues here. This is a big issue in the second largest city in this state, and it is not going away. You need to be able to answer the question about a timetable for getting it sorted and providing the funds to do so. You also need to be able to answer the questions about emergency reliefs for households now forced to shell out large sums of money for bottled water. I look forward to your reply to these questions today.
Taoiseach, please.
I very much welcome Deputy Barry's commitment to investment in our water services, and I thank him for raising this important issue today in the Dáil, as indeed he did raise with me possibly last week in the Dáil as well. Uisce Éireann is working to address the issue with water supplies in Cork City, which I accept is a real issue. There are approximately 600 kilometres of water mains in Cork City, and about 50 to 60% of them are from cast iron, and they're approximately 100 years old, dating back to the 1920s. And due to the age and due to the deteriorating condition of the pipes, they are prone to bursts and they're prone to leakage. In the old cast iron mains, sediment can become dislodged during repair or upgrade works, and it can occasionally be carried through to the customer's taps, leading to water that can very unpleasantly appear brown or orange when someone turns on the tap. Uisce Éireann has established a water quality task force which is dedicated to improving the city water quality, and Uisce Éireann's task force is implementing a plan now that includes increased sampling at customers' taps, at the network and indeed at the treatment plant, intensified flushing programmes and a water mains replacement programme. Uisce Éireann continues to advise not to drink discoloured water and to run the tap to restore water to a clear colour, but the water is safe to drink once running clear. Protecting public health is, of course, a top priority for Uisce Éireann, a top priority for government, I'm sure a top priority for everybody in this House. The treatment process used by Uisce Éireann at the Lee Road water treatment plant is fully in line with national and with global water treatment standards. Uisce Éireann does continue to review the operational performance of the Lee Road water treatment plant, and it's also now investigating additional options to further improve water services in Cork City. I should say more broadly, Deputy, we remain absolutely committed to providing investment in water infrastructure. No one can say my party ever hid from this issue. Uisce Éireann has invested more than 100 million to improve water supply infrastructure across a number of projects, including the Cork City Water Supply Scheme, which is nearing completion, the replacement of the Churchfield Reservoir roof, the upgrade of the Glasheboy Water Treatment Plant, and indeed a new Lee Road Water Treatment Plant. So these are very significant investments that have been made in the water supply in Cork. I accept that there is more to do. There is a commitment in the programme for government to ensure that Uisce Éireann is sufficiently funded to make the necessary investment in drinking water and wastewater infrastructure. And I think I've actually written to you today, I think, in relation to this matter, and I'm engaging with both the Minister for Housing and Uisce Éireann in relation to the timelines and clarity for people in Cork, for whom I know this is an important issue.
Thank you, Taoiseach. Deputy Barry.
So the Taoiseach has mentioned Uisce Éireann's new task force, a task force which came about under pressure from below, but still it's there now. It seems to operate in quite a closed and secretive way. I have asked, and campaigners have asked, that there would be a representative from one of the communities that's affected, appointed to the task force. We've asked that an experienced water worker representative would be appointed to the task force. No joy from Uisce Éireann in relation to that. Perhaps you would like to voice your support for those basic democratic demands here in the Dáil today. You spoke about the flushing plan that Uisce Éireann are putting in place, announced last night. Targeted areas on the north side of the city, Granabraher and Montenotte. No accident, I think, that Granabraher is one of the communities, given the protest that was there last week. Again, pressure from below. The feedback that we have, both from water workers and from people living in communities where the flushing has taken place, is that yes, it does have an effect. It does have an effect in the short term, but after time, the problem tends to re-emerge, sometimes to the point of being as bad or even worse than it was before. The emergency reliefs that I asked you about, could you please give me your reply to that in your sum-up?
Taoiseach.
So pressure from below is not a phrase I'm particularly familiar with, but I certainly believe the way you get things done is through engagement. It might be a difference in political ideology, but I think it's important to engage in these matters. You're a directly elected member of this House. You're doing your job engaging on behalf of your constituents. You corresponded with me on this. I've signed a letter to you today. You've raised the issue in the Dáil, and I'm engaging with Uisce Éireann in relation to this. I do very much welcome the fact that Uisce Éireann have now established a task force. I think it is an indication of the seriousness with which Irish Water are rightly taking the issues being experienced by some of your constituents and people in Cork regarding water quality. It also does highlight very much an issue that we've been trying to highlight for a very long time about the need for decent investment plans in relation to water and water quality in this country. We've had those debates in this House before. I will come back to you in relation to the emergency works because I need to get an update for you from Uisce Éireann to give you factual information in relation to that. But let there be no doubt, this government is very committed to addressing these issues. We're very committed to continuing to invest in the water supply and water treatment and support the work of Uisce Éireann, and we certainly won't be found wanting in assisting Uisce Éireann as the work of their task force carried out. But I do think there's very practical things that they are doing, some of which I outlined a few moments ago, that I hope will reassure your constituents that this is a matter being taken extraordinarily seriously.
Thank you, Taoiseach. Deputy Marian Harkin.
And Corla, Taoiseach, under the current national planning framework, your government has committed to achieving a 50-50 split in population growth between the Eastern and Midland region of Ireland and the other two regions, the Northern and Western and the Southern region. However, based on the latest population stats from the CSO, 55% of population growth has been in the Eastern and Midland region of Ireland, with population growth being overly concentrated in the Greater Dublin area and consequently much lower in the Northern and Western region. Now, these population trends are leading to even greater regional imbalances in Ireland. Taoiseach, so many of my leaders' questions over the last 4 years have focused on the growing regional imbalances during the lifetime of this and previous governments. I've quoted pretty shocking GDP disparities, household income disparities, healthcare disparities, but this morning I want to concentrate on two other issues that are further contributing to widening those regional gaps. Those are housing completions and the gap in infrastructural spend. And I believe that all of these failures in so many different sectors that I have mentioned before and the ones I'm mentioning today are contributing to the fact that you are failing to meet your commitments to a 50-50 split in population growth between the regions. Now, in regard to spending on major infrastructural projects, the EU Commission's Regional Competitiveness Index ranks the Northern and Western regions' infrastructure as 218th out of the 243 regions. We're in the bottom 10% of all EU regions, Taoiseach. And why is this the case? Well, a few months ago, Dr. Ray Griffin, speaking here in committee, said that he had done some significant work on capital trackers, that is, tracking major capital spend. Now, as you know, it's very difficult to do that in real time. But his first generation analysis showed that 64% of capital spending on major projects goes to Dublin. And on a second iteration, he revised that to 56%. But it's still a 2-to-1 ratio, Taoiseach. So that answers the question why. And secondly, in regard to regional housing activity, the picture is awful. In 2024, this year, in January, the CSO released the 2023 data on the total level of new dwelling completions in Ireland. 11% of those were in the Northern and Western region, yet we have 17% of the population, 24% in the Southern region, yet they have 33% of the population, 65% in the Eastern and Midland region with 49% of the population. So under this and previous governments, These regional imbalances
Deputy.
are escalating across one sector after another, and I'm asking you, what do you propose to do to change that direction of travel?
Thank you. Taoiseach, please.
Well, thanks, Cian. I want to thank Deputy Harkin for raising the question, and I do want to acknowledge, because before I had this role, anytime I used to take leaders' questions on an interim basis, this is an issue that I know you do raise on a very regular basis, and I accept your sincerity and your bona fides in relation to this too. Look, I would let me begin by pointing to some of the areas I think we've made progress on, because I do think when we talk about population and where we want people to live, the people have a say in this too, and we have to make it very easy for people to wish to live, study, work in the regions. I mean, that's what we do. We can set our targets nationally, and we can use our funding, and I do get that. But ultimately, we have to win hearts and minds. We have to make sure that young people living in Sligo today believe that young people can continue to live in Sligo and raise a family in Sligo and have a job in Sligo and access a university in Sligo. And we want other people from other parts of the country to say, you know what, I want to live in Sligo. So I do think some of the steps that we've taken in recent times, and indeed worked on together around the technological university, the Atlantic Technological University, you've been a big supporter of that. That's made a real difference. You can now do your PhD in Sligo. You now have an interlocutor in terms of a big university for the Northwest that can interlock with the Ulster University Magee Derry campus as well. That is going to be a game changer, and I accept there's work to do, and I know we'll talk more about the Technological University agenda, but it is an example of our commitment to regional development, because we know that not only does that keep younger people in their regions longer, we know it also helps attract investment. And you talk and I talk to any company looking to invest in a part of Ireland, access to a university in the region is a big one, and you didn't have one in the Northwest, and you now do under this government, and that is worth saying. I know on a community level, only this weekend you'd nearly blush if you looked at what Sligo got in terms of community centres compared to my own constituency, because in Sligo you had 2 new community centres announced through government funding only this week. You had one in Ballymote and one in Kilglass as well. Direct investment from government, as Frank Feehan reminds me, in Sligo as well, and that's important too. When it comes to the local improvement scheme, the roads, we saw more investment as well, 1.1 million announced for Sligo County Council in the last week. So they're just some practical examples. But I do take the point that the Deputy says, and I don't disagree with her, that we need to do more when it comes to balanced regional development, because balanced regional development is actually good for all of the country. It's good for Dublin to actually have balanced regional development as well. And we have had an over-concentration of growth in certain parts of the country. When we look at jobs, there are encouraging signs, because we've seen 90,000 jobs created over the last year, about 1,700 per week. Around 10,000 of those jobs were added in the border region, including Sligo too. Now, how do we take this forward? I think we take it forward through the new national planning framework and the first revision of it, and I will work with colleagues in this House across the aisle in relation to that. We will publish a draft of that this summer. There will be an opportunity for you and others to make a submission as to how you believe it can take practical measures to help get to that 50-50 that we do wish to see as well. So the population has grown much more quickly than anticipated. It's now clear that we will have to target very significant growth in the regions, and I would suggest finally that 55-45 figure probably has been somewhat distorted by the very significant and unexpected population growth that we have seen since the National Planning Framework was last published.
Thank you, Taoiseach. Deputy Harkin.
Look, thank you, Taoiseach. You talked about people wanting to work, study and live in the regions, and you talked about winning hearts and minds. Taoiseach, what you need to do is you need to build the houses. Stop talking about hearts and minds. Stop talking about a community centre here and there, though it is so welcome and great to see. I'm talking about the big ticket items, and you know that. I'm talking about systemic investment in the regions. I'm talking about investment in the big projects, in the roads, in health infrastructure. And what I hear time and time again is different government ministers or different Taoiseach telling me about the bits and pieces that come to the region. And of course they do. They go to all regions. But that's not what I'm talking about. And you know that. You know that I'm talking about the major investments. I told you that the European Commission itself, not me, ranks the Northern and Western region in the bottom 10% of all EU regions for major infrastructure. You can't get away with telling me you're giving a bit of money here and a bit of money there. Taoiseach, you need to systematically look at this and change
Thank you, Deputy.
direction and build the houses that you're not building.
Taoiseach.
I'm a little disappointed with that response because I do think hearts and minds matter because we live in a democracy. No, you can wave your hands at me if you wish, but I'm going to speak for a second. And I'm not going to be told to stop talking about certain things because I'm going to continue to talk about the fact that this government has proudly invested in Sligo. And look, from time to time it might suit others to suggest to the contrary. We've proudly invested in Sligo. I've been up and down that road to Sligo so many times for so many government announcements where Minister Humphreys was there at the weekend proudly. And I'm sure if you were at the events, you weren't describing them as bits and bobs or bits and pieces. These are important initiatives that matter to people in Sligo. And I'll come back to Sligo and I'll talk to the young people and I'll talk to the young people about what they want to have in their community. They want houses. Let's talk about housing. So this is out this morning. It wasn't brought up in the Dáil yet. I wonder why. Because we've now seen commencements for new houses up 63% on this quarter this year compared to the quarter one of last year. Housing is rising in all parts of our country. Government investment in housing is rising in all parts of our country. Decisions that we took in Cabinet yesterday to spend over 300 million more of taxpayers' money will benefit small developers and the local authority in Sligo build more homes as well. The investment in the First Home Scheme will benefit young people in Sligo. The development waiver will benefit young people in Sligo. The Technological University will benefit more people in Sligo. The 10,000 jobs in the border region will benefit more people in Sligo. The community centres that we announced this week will benefit more people in Sligo. Yes, we've more to do on balanced regional development, but you don't need to convince this government of the importance of investing in the regions.
Thank you, Taoiseach. That concludes leaders' questions for today.